Breast cancer is the most common cancer for women worldwide and the second most fatal cancer for women globally, killing 670,000 women around the world in 2022. 2.3 million women were diagnosed with the disease that year alone. 1 in 8 women will be diagnosed with breast cancer during their lifetime. A dreaded breast cancer diagnosis is a life-changing moment in any woman's life. Treatment for breast cancer is often harsh and includes chemotherapy, radiation therapy, and surgery to remove a lump or often one or both breasts entirely, with no certainty that the cancer is cured. And its side effects can be downright awful and include fatigue, hair loss, nausea, pain, swelling, blood clots, and fertility issues with no assurance of survival for many women. As we near the end of October, which is Breast Cancer Awareness Month, here are the top 5 ways to reduce the risk of breast cancer. Number 5. Eat a healthy diet. Eating a healthy diet that includes vegetables, especially leafy greens like kale, and cruciferous vegetables like broccoli, reduce the risk of breast cancer. Fruits, beans, fatty fish like salmon, whole grains, fermented foods like yogurt, and nuts like walnuts and almonds also cut the risk of the disease. Some herbs and spices like oregano, parsley, thyme, ginger, curry spices, and turmeric also lower the risk of breast cancer. Number 4. Avoid smoking and drinking alcohol. Smoking increases the risk of 15 types of cancer, including breast cancer. Women who smoke are at a 16% increased risk of developing breast cancer during their lifetime, so it's best to quit smoking and avoid it altogether. Drinking alcohol also increases the risk of breast cancer. For example, alcohol either causes or is linked to 7 to 24% of breast cancer cases in many countries around the world, including European countries, Canada, and the United States. 7 or more drinks per week puts you in a higher risk category for developing breast cancer. Number 3, exercise. Women who exercise regularly have a 10 to 20% lower risk of developing breast cancer. The American Cancer Society recommends 2.5 to 5 hours of less strenuous activities per week, like walking and yoga, or 1 to 2 hours of more strenuous activities per week, like jogging or playing tennis. And always remember to drink lots of water. 2.3 liters of water per day is recommended by experts. It's also important to get enough sleep. Number 2. Cancer screening. Studies show women who get regularly screened for breast cancer after the age of 40 have a lower risk of dying from the disease. Mammograms, which are x-rays of the breasts, are performed every 1 to 2 years after the age of 40 or 50, depending on jurisdiction, in many countries around the world. Some have argued that the age that women receive their first mammogram must be lowered because the rate of breast cancer among women under the age of 40 has been on the rise over the past few decades. Younger women are also more likely to be diagnosed with more aggressive forms of breast cancer. Young Black women, in particular, are at a higher risk. And number 1, testing for risk and taking preventative measures like medication. You can find out if breast cancer runs in the family and then get a genetic test to see if you have a genetic mutation that puts you at a higher risk for getting the disease. For example, BRCA gene mutations are present in 12% of breast cancer patients under the age of 45 and are particularly prevalent in women of Ashkenazi Jewish descent. If you are at a higher risk, talk to your doctor about preventative measures available to you. Some examples include raloxifene, sold under the brand name of Vista, and tamoxifen, which are medications women can take to reduce their risk of breast cancer if family history, genetic screening, and other testing put them in a higher risk category for the disease. Additionally, if you are deemed to be in the high-risk category, avoiding hormone replacement therapy at menopause may help. There are other options available for women at a high risk for developing breast cancer, like breast reduction surgery or preventative mastectomies, where one or both breasts are removed in order to reduce the risk of developing the disease. Women should always discuss the options that are available to prevent breast cancer with their doctors. Remember that the next big breakthrough in the prevention of breast cancer might be just around the corner, so always ask if there are new medications, therapies, or late-stage clinical trials for women to reduce their risk of breast cancer. It's also important to watch out for the warning signs of breast cancer regularly. a lump in the breast or armpit, a change in the size and shape of one or both breasts, or redness, unusual skin changes, and swelling of the breasts are all signs it's time to see a doctor. Breast cancer has a 99% survival rate when caught early, so don't forget to take charge of your own health. The information in this video is not medical advice. You should always consult a healthcare professional if you have any health problems. So that's all for this video. Visit News in 5's YouTube, Instagram, and X, formerly known as Twitter, pages often for our future videos and other content. Don't forget to subscribe to the News in 5 YouTube channel and social media pages. Remember to check out our website, newsin5.net. Visiting our website as often as you can is an excellent way to support this media company.